So I would like to call the Mason County Board of Health regular meeting to order. This is September 24th at 3 p.m. And first we will have introductions. Want to start?
Sharon Trask, Mason County Commissioner.
I'm Peggy Van Busker with Hospital District 2.
Gary Plews, Fire District Commissioner.
Kevin Chudy, Mason County Commissioner.
Dan Stein, Health Officer.
Dave Wyndham, Mason County Community Services Director.
Lydia Buhite, Mason County Community Family Health Manager.
Kathy McDowell, City Council number 2.
And our audience.
Hi, I'm Shelley Slaughter, Director of Thurston County Public Health and Social Services.
I'm Liz Davis, Director of Child, Family, and Community Wellness at Thurston County Public Health and Social Services.
I am Gretchen Toller, Maternal Child Health and Nurse Family Partnership Manager.
Lori Montoya, Nurse Supervisor, Mason County NFP Program. Erin Bergwood, Executive Assistant to Shelley Slaughter of Thurston County Public Health and Social Services.
Dale Taja, On-Site Advisory Committee.
Tom Davis, Veteran Advocate.
Dave Gardner, Program Coordinator for Opioid and Substance Use Response at Mason County Public Health.
And I'm Randy Eaton, and I'm a nurse with Nurse Family Partnership here in Mason County.
Thank you. And I would entertain a motion for the agenda.
So moved.
Second.
All those in favor?
Aye.
And I would make I would hear a motion for the minutes.
For minutes,
Yeah.
I move that we approve the minutes.
A second.
All those in favor?
Aye.
Okay, so we have a presentation from Nurse and Family Partnership.
So it's Shelley Slaughter is my counterpart over with Thurston County, and 2 years ago we transitioned Nurse Family Partnership over to Thurston County in a partnership with Thurston, Mason, and Lewis counties. So this is their opportunity. Shelley's got her team over here to talk about what's going on with Nurse Family Partnership here in Mason County. Now get out of the way, so push buttons.
You want us to come up to the
Sure.
podium?
Yeah.
And I'll get out of the way.
I can move too, so somebody can sit here.
I'll just say.
Thank you.
It's on the laptop, your Surface would not connect.
Okay.
Oh, shoot.
I can press buttons if you need to.
That would be great.
I'm sorry. Oh, yeah.
Well, good afternoon. Again, I'm Shelley Slaughter. I'm Director of Thurston County Public Health and Social Services. And on behalf of Thurston County and our Board of Health, I just wanted to extend to all of you our sincere appreciation for allowing us to do this work in your community. We so appreciate and value our partnership that we have with Mason County and all our community health work that we're doing together across the region to make an impact. And I have the great privilege of getting to work closely with David on many different committees and boards, and it's just it's really wonderful to get to work together with you, and we're really happy to be able to share some of the impact that we have had with our Nurse Family Partnership Program. And so without further ado, I will pass it over to Gretchen Toller. She is our Maternal Child Health Program Manager, and Lauren Montoya, our Nurse Supervisor.
Hi, thank you for having us here today. Like Shelley said, I'm Gretchen Toller, and I'm the Maternal Child Health Manager.
I'm Lori Montoya, Nurse Supervisor.
Sorry, do you mind? Okay, so Nurse Family Partnership is an evidence-based home visiting program. It's got over 40 years of research and shows that it positively impacts the lives of families and communities. It is a program that's multi-generational and provides both prevention and intervention to communities.
So Nurse Family Partnership has 3 program goals. The first goal is to improve pregnancy outcomes, and
That includes reducing the number of preterm births, the number or rates of children being born at low birth weight, and then also reducing both maternal and child infant mortality. The second goal is to improve child health and development, and we do that really as partners, you know, with the parents. So what we do is kind of team up with them, and we help to show them that they're their child's first teacher, and then, you know, also showing them that their child's social and emotional needs. And then the third goal is to improve economic self-sufficiency of the families. And again, we just partner with the parents and with families and help to support them. We use routine goal settings that are client-centered. And a lot of times those include things like higher education and career goals.
So NFP moms receive care, information, and support from nurses that are specially trained in the NFP model. This is extra training around pregnancy, early childhood development, and the approach of NFP, which, like Lori said, is very client-centered. Our program has the most extensive research showing outcomes from 3 randomized controlled trials that help. The outcomes are healthier pregnancies, reduction in child abuse and neglect, improvements in cognitive and language development, fewer childhood injuries, and many more cost-saving outcomes to government and society. Nurses offer regular in-home visits. They go approximately every 2 weeks to the family's house, so we enroll clients during pregnancy and we continue those visits until the baby turns 2 years old. And why this is important is because in those first 1,000 days during pregnancy and the baby's first couple years of life, they've got 700 to 1,000 new neural connections forming every second in their brain. And so those interactions with the parent makes a difference for how many of those connections stay in place, because the brain starts to do like a pruning process. So, but the more a baby is held or responded to or has their needs met, the more those connections stay in place.
So why nurse-family partnership? I think Gretchen just spoke to the reasons why thinking about baby's brain development, reaching them in those first 1,000 days. And we change the future of most vulnerable babies born into poverty by equipping the best person, and that's mom. We help them to become confident parents. And as a result, what we find is the outcomes lead to hundreds of thousands of dollars for societal benefits.
So a RAND Corporation analysis found a net benefit to society of over $34,000 per family served, high-risk family served in nurse-family partnership. You see a $5.70 return on investment for every dollar that is spent on nurse-family partnership. And those savings come to areas like Medicaid, law and justice, social services such as TANF use, child maltreatment, and the school systems, just to name a few of those. So Dr. Ted Miller did a report, put out a report, and based on over 177,000 pregnant women enrolled in NFP, they project that by the year 2031 that we will see these outcomes. And I do have another sheet I will pass out to you at the end that looks at if they scaled up NFP totally in Washington State, what you could see as outcomes in our communities there too.
So as far as Mason County goes, you can see in 2018 that we've been pretty busy. So we've had 603 home visits and office visits. We've had 52 infants born, provided services for 71 families. And 99% of these families were 220% poverty level or below. So this information for Mason County is pulled from our strength and needs assessment tool that we use in NFP. It's called our STAR assessment. So if you look at Mason County, what we're seeing is that most clients at enrollment are struggling with homelessness or residential instability and or mental health issues.
So in 2018, we received Fight Crime Invest in Kids Champion for Children and Youth Award in Washington State. We successfully implemented the first Tri-County regional site, and it was a busy year, like Lori said. We had a lot of referrals in Mason County. We've been able to have a bilingual nurse here along with Randy, and they've just done an amazing job in the community. So between the 3 counties, we worked with 375 high-risk families between Thurston, Mason, and Lewis County. So with the STAR tool, we've really been able to focus in on some of the challenges that families are facing, and we're seeing, you know, in all 3 counties that many families are facing a lot of housing concerns and then a lot of mental health and substance use concerns.
So goals for 2019, as you can see, the first goal in there is to expand to meet the community needs. So we're often finding that we're having a wait list for our referrals. So we're continue to look for funding to be able to support more nurses, to be able to support the community, including bilingual nurses for Mason.
So in 2016, the Federal Commission to Eliminate Child Abuse and Neglect Fatalities released their report, noting there was few examples of solutions that worked, except for nurse-family partnership. That was one that rose to the top that they were actually seeing results with. So. That's just some final thoughts. Any questions for us?
Yeah, I have a couple of questions. First, appreciate the visit from Thurston County. It's always nice to see our partners from the other side of the county line come over here and talk about programming that we work on together, so appreciate that. Just kind of curious as to how you do recruitment for eligible mothers in Mason County, what that kind of looks like. Just general thoughts on that. And then going back to your data about where mothers come into the program experiencing issues of homelessness and the depression and anxiety and other behavioral health issues and that kind of thing. What's the pre, what's the post look like? I mean, is there, what kind of improvements are we seeing in those areas? And kind of how do you collaborate with other partners on those issues?
So great questions. So we've done a lot of outreach. Randy has, she lives in the community, and she's, been great about making a lot of really strong connections. So right now we are housed with Community Action Council with WIC, and so that's been a referral source. Also, Options Counseling has been a good referral source. The schools, Community Service Office, Mason General, and Mountain View Women's Health. So we've kind of been doing a lot of outreach to a lot of different partners in the community, and I think it's been pretty successful. So we at one point we had a lot of referrals come in the first 6 months, and it was challenging to be able to keep up with all of them, to be honest. We did have a pretty extensive wait list for a while, so definitely, continuing to look for more funding, because we'd love to get what is funded for Mason County is 1.4 FTEs from the state, but we would love to be able to get that at least up to two full FTEs.
What would that look like money-wise?
Probably, maybe another, how much more you mean?
Yeah, they do the 0.6.
Maybe 70,000, 60,000, somewhere in there. I'm trying to, that's a guess.
Ballpark. Sure. That's fair, yeah.
Yeah. And then as far as the the outcomes. So the STAR tool is used on intake and then multiple times throughout the 2.5 years that the client and nurse are working together. I don't know that I could speak to how much of an improvement there is, although I know there is. I just don't know the percent off the top of my head.
Sure.
And part of that is just the cycle. We haven't had a full 2.5 years at this point. But it's something definitely that we can run to see where we're at even partway through. That's something that we track. We've tracked closely in Thurston County because of our 1/10 of 1%. And so typically we're seeing around like anywhere between 45 to 70% improvement in those areas. So the housing is a challenge, but the mental health piece, our nurses do a lot of work with families to connect them to services, but sometimes it's hard. Families may either struggle to get there, or they may have history of not wanting to work with counseling or other people like that. So then we do what we can from a nursing perspective. So working on nutrition and mindfulness and healthy relationships and things like that. But we worked a lot with the transitional age youth counselors through community services here in the community, and have connected a lot of families with them too.
Great.
So
thank you.
Any other questions?
Of course, I would be asking. Do you guys know, I know it might be hard off the top of your head, but the breakdown between how many Hispanic clients you're serving versus our Caucasian population?
We could serve more Hispanic. I mean, that would be if I could bring that FTE up, it would be a nurse full-time here, bilingual. Probably, I mean, just by nature of the staffing, I would say it's more Caucasian. I mean, because Randy has a full caseload. And then the nurse that's here part-time is bilingual, but she could definitely be full-time.
So, okay, I'm going to get to numbers because I really do want to know numbers today. So you had 71 clients that you saw in 2018, it said. But we know that you didn't have 71 open at the same time, because that would be well over 1.4 FTE. So approximately how many are you keeping cases open, and is there any way of knowing the difference? I mean, 5 for Hispanic versus, I'm just trying to get an idea in my head is all.
I mean, I could get you the numbers.
Okay. Yeah, it'd be nice to kind of know how that's looking with the Hispanic, because 25 caseload for a full-time is all you do. Max. So 71 clients doesn't indicate that there were 71 people on the rolls the whole time, because people come on and off and like that. So I was just trying to feel for what kind of impact we're making in the Hispanic population, because it is one of our larger teen pregnancy areas that we're dealing with, and that seems to be climbing higher and higher. And I just didn't know what kind of impact we're making in this program at all.
We are, most of our nurses, the caseload is supposed to be 25 active. Most of our nurses are carrying closer to like 27, 28 clients. The part-time nurse, I'm trying to remember what Amanda's at right now, I think is over technically what she should be as well. So there is a definite need, and yeah. I will try to get you the numbers for the breakdown.
Yeah, it'd just be nice to kind of figure out, because we weren't, serving with Nurse Family Partnership, the Spanish speaking, so I'm real interested in knowing how that might be impacting. Especially watching our teen pregnancies is still climbing in that area, pretty high, and culturally it's happening. But and then probably lost the thought.
Well, if I could just jump in really quick, I think that Gretchen and the leadership team of NFP have done a really great and concerted job of hiring bilingual nurses and really working to recruit nurses who speak both English and Spanish, because we know that we have that need in Mason County and Thurston County and also in Lewis County. It's not always as easy as we might like it to be, but I know that that has been a real priority and an area of outreach for them in the last couple of years since I've been with the department. So I want to thank you for that.
Yeah. We actually are, we just hired another nurse who's bilingual and are looking at another position for Lewis County right now, and another bilingual nurse. So we're happy and fortunate that we've had strong applicants. So.
Any other questions?
I still have a couple more. Sorry, I'll go real fast. So just out of curiosity, I know they made some changes in what data I don't know if they made total changes in what data you collect compared to what we collected all those years. Has that changed a lot with the new program?
The new system, yeah. The new system was delayed, and so we have not transitioned yet.
Oh.
We are supposed to transition this next month. Yeah, it's been a long delay. So.
Okay. Is there any way we can get, because when we originally transferred over to you, we asked for regular quarterly updates on kind of watching that data that we had been watching for 10, 12 years. Is there ways we can get ours, or is it hard because putting them together like they tend to on?
It's challenging with ETO just the way it's been merged together, but we have found ways to tease it apart. We'll just have to figure it out with the new system, but I'm hopeful that it will be easy to do. So yeah, definitely.
If we sense, I don't expect all anything. I know how many points there are, but just is there a way we can ask for some certain ones that maybe we can track? Because it'd be nice to be able to see after all the years we did the program how we're continuing as a community in moving forward. It would be nice to see. And then one last thing. Housing, have you connected with our housing people? Because we have our quite a housing forum that works together. So if there's anything that they can help you with, because I know housing, yes, it's a huge problem. And then last, are we still having a lot of no-shows? Is that still going on? Used to, quite a bit. I'm just curious if it has changed or not.
I would say not as many no-shows as just cancellation and rescheduling.
Yeah, that was
there are definitely some no-shows, but I would say more people like reaching out and saying, hey, this came up, so can we reschedule?
Yes, that used to be a huge problem. I think the texting helped that be a problem. It makes it too easy to cancel and change. Yeah. Thank you.
Okay.
Sorry. So just again, when moms drop out of the program, or you don't see it all the way through for the full 2.5 years or whatever it is, what are some reasons that they tend to drop from the program, and what can we maybe be thinking about that would help address some of those issues?
One of the biggest reasons is moving out of the service area. So we see that also in Thurston County quite a bit, just with all of the housing instability for families that, sometimes they're moving to be closer near family, or they're moving somewhere where they can get housing. That's a big one. Randy, thoughts on the other ones?
I would say one that is not necessarily great for us, but is great for the family, so it's kind of conflicting in the data, is where moms are going back to school or got a job, and so it's really hard to match up our schedules, which is fantastic because that's one of our goals, is to get them in that place in their life, but then sometimes it interferes with their ability to finish the program.
We as a team are working on a continuous quality improvement project this year for the full year, though, on family engagement. So if it is for a reason that's not to go back to school or not to move away, maybe they just didn't connect well with the nurse or something, we are working internally always on improving our approach with families and making sure we're meeting their need. It's a voluntary program and it's for them, and we always try to keep that at the forefront of our mind. Like, you know, they signed up for a reason, and are we getting at that reason, not our own agenda? So.
Very good. Any other questions? Okay, so let's move on then to the health.
you.
Thank you so much
Yeah,
for
thank
having
you.
us.
Thank you.
It was very informative. So, you're up.
Wonderful. Well, first of all, I just want to reintroduce myself. I'm Dr. Stein. I'm the new health officer for Mason County. I've been living in Thurston and Olympia for the past 7 years now, and I've been loving the area, and I really appreciate the opportunity to work with this county. So thank you for allowing me to sit here, and it's a great opportunity. I know that Dr. Yu is a real huge pillar in this community for many years, and I know that I've got some big shoes to fill, so hopefully I can work with you guys to move forward with promoting health in our area. So I've been at this position for almost 3 months now, and I'm starting to get to know certain aspects of the community, and starting to have some certain priorities that I'm starting to work on, and some projects. First of all, we have been applying for Foundations for Opioid Response grant. It's a grant through McKesson, which is a healthcare and pharmaceutical organization. And we have been approved to apply for the grant. It's a 2-year, $600,000 requested amount, and the focus of this grant would be to address the barriers of obtaining medication-assisted treatment for opioid use disorder. So we kind of have 2 aspects that we're going to be applying for, which is, first of all, expanding access to medication or MAT therapy within the jail settings. And that would include funding for medication-assisted therapy waivered provider, a nurse case manager, and a peer recovery specialist. And also it would be focused on establishing a plan and continue following these people in reentry for 90 days after they're discharged. The second part of this is to hopefully develop a low-barrier buprenorphine clinic, which can also help cater for our high-risk opioid use disorder population. This is hopefully to connect with community providers, mental health, counseling, and other recovery support specialists. There's a similar clinic that's been developed in Olympia and also in Grays Harbor, and we're kind of using that model to help expand that in our area. The second area that we're starting to focus on is and we're going to be talking a lot more about this in the coming weeks to month. We have a coalition dinner, which is scheduled for October 24th, I believe. October 24th. And this is going to be working with the community stakeholders to establish a set of priorities to focus on within the county. I'm also at that meeting hoping to introduce the idea of expanding the emphasis of the Department of Health becoming a backbone organization. And by that I mean I want to work on partnering with local community organizations and potentially creating a mission of utilizing and coordinating and collaborating to create a system of community partners to promote the ultimate goal of improving the health of Mason County. So kind of the basic idea of this is that we have a lot of wonderful organizations within our community that are doing some great work, but there's not necessarily a single entity that's helping organize and making sure that we address all the needs of our population. And so unless someone else steps up, a community partner, I figure that we should be the ones who take the lead on that project. And so I would hope to sit down with the Board of Health at some point before the end of the year to hopefully work on expanding this idea and discuss some of the priorities and establish joint priorities and strategize with you guys before the end of the year to hopefully get this project moving forward. I also want to talk about vaping. That's a big a big topic right now. We just had our first probable case of vaping-associated lung injury in our county. We are the 4th in the state. Now there are six people who have been affected by this outbreak. So I understand that there's some time on the agenda later to talk about a couple of those ideas, but I want to focus on one, looking at the idea of prohibiting vaping on public lands, and 2, consider looking at prohibiting flavored nicotine products within our county. The last thing I want to just mention is that I'm currently completing my Master's of Public Health through the University of Washington, and part of my capstone project through the University of Washington is that I'm planning to develop a program to address hepatitis C in our area, so specifically in our high-risk patients utilizing IV drugs. So currently we have access to be able to perform screenings for hepatitis C, but there's not really a set path for getting the confirmatory diagnosis, establishing care, and ultimately getting treated for this condition. This is a big hot button issue, mainly because for one reason is that there is a new emphasis on, there's a goal for eradicating hepatitis C within Washington State by 2030, and we now have very successful treatments to help address this issue. There's not new guidelines for providers to treat individuals, not wait till they're abstaining from IV drug use or alcohol, to treat people where they are and get them, prevent them from transmitting this disease. And there's also newer recommendations for expanding availability for providers to be able to prescribe these great treatments. The state has been working with a couple of pharmaceutical organizations, and we now have reduced the cost of these medications. When they first came on the market, they were about $72,000 for a full course of treatment. They're now down to $7,200, and they are now covered under Medicaid with no prior authorization required. And we also want the primary care providers to be the center of prescribing these. And these are newer guidelines, so I'm trying to work on expanding the knowledge of these treatments and get these high-risk individuals into treatment to help eradicate this disease. So those are my initial goals. I know that we're going to be talking about a few other issues that we're working on, but I'd welcome any comments or questions about those issues.
Wow. You're biting off a lot already. That's good. Okay. Any other? No questions. Okay. So administrative report.
Okay, so in your package you have my regular letter, and in that I talk about smoke. I talk about some of the foundational public health monies. Just as a recap, the legislature approved $22 million for public health, which is actually only about $7 million of new money, but then they only stocked the account with $18 million. So we're a little short on that. So we're going back to the legislature this spring with it's called a technical correction to the budget, and see if they can technically put some more money back in that fund. That's one piece we're working on. We're working on another ask for additional funds, and the consensus was to work around Hep C and immunizations. As the governor has given an executive order, we're going to work on Hep C, but there was no money attached to that, so it's a little difficult to do the work without the funds. So we're going to go to the legislature and ask for some additional funding for that. So with that, I finished up the annual report, which is usually much earlier than this, but we've been working a lot on water resource inventory areas. That's been a huge part of my work this spring. Actually, just go ahead and send those around if you would. Go in there.
Did you all get one?
Normally I get these all bound and plasticized, but that that process alone last year was like $600. So we have the much less expensive version this year at about $100 to do this all our printing. Yeah.
But
so-
it's going to be on the web too, right?
And it's going to be on the web. Yep. So
That's less.
the annual report's kind of broken into different pieces. The first piece is if you go through, there's kind of a letter from me, talk about the leadership, talk about our mission, and then I go right into budgets and breaking out how we are funded and how we are not funded and how we spend our money. It's important to note that community services is funded in two ways. So if you think of it as upstairs with the community development folks, our general fund, their current expense folks. Everything downstairs is special fund, public health. So we have two completely different sets of books, and those are denoted in here. Public health, primarily driven by grants, and upstairs primarily driven by fee-for-service. Although downstairs in EH we do have fee-for-service as well. So then it goes into, after that we talk about some graphs and charts, talk a lot about community development. Then we go into community health, and then finish up with environmental health towards the back. So environmental health, kind of put all of our data on one page, just kind of a snapshot. And Alex broke it out for me as first half of 2018, second half of 2018. So you kind of see what seasonally we're looking at in environmental health. Anyway, I'm not going to talk a whole lot about what's in the report. It's just there for folks to look at. It's going to be on the web. We started doing these in 2016, I think. But for the whole department, yeah.
2016.
So and it gives us a good look at what the department is doing altogether, and then breaks it out by the individual pieces. So, are there any questions on that?
Well, not till we read it.
Not till you get into it, yeah. So shoot your questions to me. Like I said, a lot of my time this summer has been around water resource inventory work, and that would seem to be very development driven, but I'm starting to pull more and more public health things into it, because as we go into development and we go into where the population is going to go, you have to figure out what the population looks like. And what people aren't taking into account is that our population, we have this bubble at the 55 to 60-year-old category, which is going to age out in 20 years. So they'll be gone. And then our population pyramid is no longer a pyramid. It's very much a column of population. So we don't have a big base at the bottom and much narrowing at the top. It's just very much a column, kind of stagnant population. So it changes how we look and think about housing as time goes by. So right now we're already behind the power curve for housing for elderly citizens, and by the time we get that in place, we're going to be into this column. So we need to start thinking about those now in the planning process for 20 years down the road. So trying to interject some public health work into what's typically just kind of a straight up community development. And with that, I think that's it for me on administration.
So, what's the housing right now for elderly? And what will it be?
Well, there are a number of developers that are working on some projects. I know of one in particular in the city of Shelton that's looking at 25 small apartments at like 500 to 600 square feet, level entry. There's some developers that are looking inside Shelton, inside the Belfair UGA. So in Belfair, we're looking at hopefully a 100-unit apartment complex up there. So
all on ground level.
No, that one won't be. So, in fact, what we did with community development is we raised the height limit from 35 feet to 55 feet, so we can add another floor in order to get some of these developments to pencil out. Because of hookup fees and latecomer fees, what happens is you start to exceed that $65,000, $75,000 per door, and it becomes unfeasible. So we added another layer to that to hopefully get those things to pencil out.
Okay, any more questions for Dave?
Any tiny house projects going on?
The only one I know of for sure is inside the city, and it's going to be up kind of area where the Y is going to go up there.
by Christmas Village.
Yeah.
For veterans.
The
housing.
Right.
Oh, okay, I didn't see that in the paper,
Yeah,
right.
and typically those pretty much need to be in a place where they can be serviced by city water, sewer, and transportation. So in order to make those really work. So we won't be seeing many of those out in the county, but really inside the UGAs and the city of Shelton.
Okay. Lydia, you're up.
So you should have all received my manager's report. I won't go through it because it's more data. And you probably have plenty with this one. But you can take a look and see what our team's doing. We had planned to do, had been working with Commissioner Schutte about making a month of immunization awareness, and we wanted to tie it in with the Board of Health. So it's October, since this is the meeting before October. We're wanting to do a proclamation, so I'm going to read it and see if you all agree to it, and we can sign it. And sorry, Melissa, this did not get in the packet. We got it ready so early, it got missed from going in the packet. So that's a new problem we have to deal with. So whereas it's important to vaccinate children on time according to the childhood immunization schedule in order to provide the best protection early in life when babies are vulnerable and before they are likely to be exposed to diseases, whereas giving babies the recommended immunizations by age 2 is the best way to protect them from 14 serious childhood diseases, whereas currently the United States has the safest vaccine supply in its history, whereas most parents vaccinate their children, resulting in high vaccine coverage rates in the U.S., whereas to stay protected against serious illnesses like the flu, measles, pneumonia, adults need to vaccinations too, whereas when people are unvaccinated, outbreaks of disease like pertussis, whooping cough, and measles can and do return, whereas vaccine-preventable diseases still circulate in the United States and around the world, so continued vaccination is necessary to protect everyone from potential outbreaks. Even when the diseases are rare in the U.S., they can be brought into the country, putting unvaccinated children and adults at risk. Now, therefore, the Mason County Board of Health do hereby proclaim the month of October 2019 as Immunization Awareness Month in Mason County. We encourage parents in Mason County to make vaccinating their children a priority and to talk to family and friends about protecting their children with vaccines. We also call upon Mason County businesses, government agencies, community-based organizations, and service groups to spread the immunization message throughout their communities.
Do I hear a motion?
I move approval of the resolution promoting October as Immunization Awareness Month.
I'll second that.
All those in favor?
Aye.
Thank you.
Okay.
I'll pass it around for signature. Is that okay to do that? Melissa, I'm looking at the guide.
Yeah, I apologize. So that was a resolution?
It's a proclamation.
Proclamation.
It's a proclamation.
Okay.
Proclamation.
Yes, go ahead.
Thanks. Thank you. Okay, and then the grant that Dr. Stein mentioned, I just kind of wanted to get a little discussion or just response. That's it's a foundation, it's a brand new foundation that was created by money being donated from McKesson in the U.S., and this is the first round of grants they're going to do from it. They were granted $10 million, I believe. And so is that something the Board of Health sees and feels comfortable with us pursuing that? I'm so glad they had us do a letter of intent first instead of spending 500 hours on writing a grant and not getting it. So we were accepted from our letter of intent that they accepted the project. So
I'm excited about it because I was surprised to see how many deaths we had with opioids after we had gone down.
Yeah.
Yeah,
I saw that too.
And we will be discussing that at length next meeting.
I
Not
was,
just that, but everything.
I was very disappointed with that because I thought with all the naloxone and...
It did go down, but we're still within our mean.
Yeah.
Our median.
So,
not the statistics per se.
Yeah, and so then I wonder, was some of it intentional or was it, yeah.
Yeah, we will give you some more discussion about that. Good question and request. And so we're planning for the November meeting. We are going to be doing a sum up on what's been happening with all of our data from our COPE project, and because we'll have it all ready and we'll have the presentation done. So we'll be hoping to share that with you in November with lots of answers to some of the, well, as best we can answer. Sometimes we don't know the answer, but so anybody else opposed? Feel like that's a good thing? on the 4 grant?
Certainly not opposed. That it would be if you could share the letter of intent with us so that we have.
Well, it's the letter of intent is not just a letter, it's like a mini proposal, and I'd be glad to share it with you all, and then you can read what
I
the
don't want to burden
project
anybody
is.
else with the reading, but I'd be interested in
It's
reading
like-
it just for familiarity.
Perfect.
But I think
Yeah.
you know, to kind of the Peggy's point about the increase in fatal opioid overdoses, you know, I think it just speaks to how much we need to double down on our efforts and continue to work at this. You know, it's kind of like you know, we saw with the, with the immunization and vaccine debate that kind of raged over the past year. It's easy sometimes to think that we've turned the corner on some of these things because of the progress that we've made. When you see a measles outbreak, you know, that's you know, a serious public health issue and a serious economic or financial issue on especially rural counties that would have to deal with an outbreak like that. But I think with issues of public health, you see that, and you just got to double down on your efforts and keep after it. So.
Yeah, and this is we still need more medicated assisted treatment in the community, and we're very aware of that gap. We've definitely made giant strides in the past 2 years, but still needing more of that. The jail needs support.
That would be a big,
yeah,
having it with the jail.
Yeah. But so, and they're in favor. We're just having to get the details out, but so I think it'll be a good opportunity if we can get it. It'll be nice. And again, for sustainability, just so you know, we always look ahead to sustainability because we do not, public health department does not have the funding to fund this stuff. So, I mean, my entire division is funded except for communicable disease nurse is funded by grants. So, and I have 7 people. So, we've got to always look ahead to sustainability. So again, with this grant, we are looking at our partners, and this grant would be comprised, as you'll see when I send you the report of it, it's comprised of other agencies doing the work that they're already doing and partnering together to accomplish it, and us kind of overseeing rather than us doing the work. So anyway, hopefully that model is kind of a new model that we put out there, and we'll see for rural counties, and we'll see if they like it. So, and then the Health Coalition dinner that was mentioned also on the 24th. Did you all get your invites?
I did.
Yeah.
And that's at Fallbrook, right?
Not yet. I did.
You should have gotten a formal invitation plus an email.
When did they go out?
Last week.
Yeah.
Just checking
Last
my
week.
mailbox. It hasn't come in.
Okay,
yet.
so
don't think that
It's
I'm
like
that.
a birthday card.
yeah, it's about this big. So okay, so I'm hearing 2 that don't seem to have gotten theirs. So again, so this isn't public health that's doing this.
Right.
This is actually a grant that our Health Coalition got from the Medicaid Transformation Project, the Cascade Pacific Action Alliance, and so we're kind of helping support it. We're part of the coalition as well, and we're trying to develop this health coalition sort of coming after Mason Matters. If you can think of, that's kind of some of the work they did for 15 years. So this was kind of a kickoff. Some people are feeling like they weren't invited in the community, and it's just a kickoff to get started and try to be able to develop some priorities, as Dr. Stein was talking about. Being able to figure out where the community wants to narrow in on priorities so that we as a community and all the partners can work together in this fashion. And so this was kind of something to try to begin to bring stakeholders together, some of the stakeholders that have been involved already. And then there's going to be plenty of room for the entire community to be involved along the way. So just kind of want to let you know that, but having the board present, really great opportunity to get involved with it.
If I could, if I can back up just a little bit. Yeah. When you think of Choice Health Network is out there, and they've been there for 30 some years, and Shelley Slaughter and I are both on the board of Choice. Below Choice is the Accountable Community of Health, and that's
Cascade Pacific
Action Alliance. I'm the secretary. I missed a meeting. I missed a meeting, and I found out I was the new secretary. And, so Shelley and I are both on the board of that as well. And one of the goals of that was to take this Medicaid transformation money, and most of that has gone out to direct care treatment type work. But the savings that comes from that, we've lobbied really hard within CPAA to turn around and put more of that back towards prevention, because that's where you get most bang for the buck. Instead of just rolling it back into a new treatment model, let's put it into upstream work. So CPAA came to public health. They're going to all the jurisdictions to make sure that we have a vibrant community organization that they can put money to the community through. So that we're going to build this as a conduit so that money can go out to the community.
So this is all being supported by this funding, and it is fulfilling some of the deliverables that are being required in the first year, and that's one, to gather stakeholders together and meet and discuss the priorities in the community. So anyway, wanted to just kind of clarify that a little bit. We will be sending another email with a little bit more of what the agenda will look like and the expectations for those that are attending.
Good. I've had a couple of people come up and ask me about it. And
Yeah,
they're a little
we've
confused,
heard
so the
that.
more-
Yeah, so we'll fix that in
Thank
the
you.
next week or so and get that taken care of for everybody. And then last but not least is Abe. He is going to share a little bit about the overdose awareness results, the walks, and take it away.
Yeah. First of all, main reason to be here is just to express my gratitude and thanks to the board for your support of making August Overdose Awareness Month. Like you guys talked about just a minute ago, obviously overdose death is a subject and topic that impacts our community greatly. So we just wanted to express our thanks for making Overdose Awareness Month here in Mason County. And it led up to our Overdose Awareness Day events. I wanted to personally thank those that came out and thank our leadership for supporting our efforts. Our first event up in Belfair was a success. We had about 60 people there. We had about 15 different resources at the library. There were individuals accessing those resources, and then we had a really cool opportunity to head down Highway 3 with our signs and our shirts, and the community responded really well. A lot of people waving and honking and supporting the cause. It was a really neat opportunity for us. The third annual Shelton event was the following day, and that was a success as well, despite the weather. There was lightning and thunder and all kinds of craziness, but we had probably about 125 people show up. All said and done, we had over 20 different resources, agencies show up, and people were accessing and engaging with those resources as well, which was really encouraging. We also got to go on the walk as a group, and we had a great response from the community as well. People waving and honking, and it was just it was a really cool ordeal. So we're really looking forward to next year's events. Hoping everyone's able to make it, but above all else, just wanted to really express our gratitude and thank you to the board and to our community leadership. So thank you very much.
Thank you. Did I send the proclamation around?
Yeah.
Okay. It's like now I've lost it.
Okay. Thanks. So, environmental health, and I don't see Alex.
Alex
is
I'm
sick.
presenting for Alex. So first order of business is we have a nomination for the On-Site Sewage Advisory Committee. I'll pass these around, if you would. And this is for Evie, and I'm going to slaughter this pronunciation. Fagergren?
Fagergren.
What's that?
Fagergren.
There we go. And she's with the Shellfish Growers Association. Comes recommended by the Shellfish Growers Association.
I know her.
Okay.
Yeah.
So my understanding is this body
So there's
selects.
there's a vacancy. Is that what we're?
Yeah.
So, Dave, just a point of clarification. So, is she an Olympia resident?
No.
No?
No.
Who's in the Parkway in Southwest?
If it's the same one I know.
Well, this
Her address is
Or Olympia.
That might be the Calm Cove Oyster Company address.
I think it is. It's Dwayne's wife.
I think I could clarify that. My name is Dale Taja. I'm the president of the On-Site Advisory Committee. I've had some emails with Alex Pacey concerning the appointment of Evie, I believe. And in that email, he had indicated she was a Thurston County resident. She has shellfish property in Mason County. That's my understanding.
So there's, since this is an industry representative, we don't have to worry about residency or anything.
You know, I'm not read into their bylaws.
I assume Alex has.
Mm-hmm. Yes.
He would have
Yeah.
probably
Yeah.
flagged it if it wasn't allowable. Is that?
I think so, yeah.
He did say to me it's the only one they've received.
And the only one they've received from growers, so.
Okay. So,
You can do an approval pending a review of the
yeah, we
the,
do that.
Yeah.
bylaws.
Yeah, I'd be good with that.
Okay.
So moved.
Second.
Okay, so all those in favor?
Aye.
Aye.
Okay.
He included in his packet his piece he's been from the environmental health director. We've had 3 of our employees, environmental health specialists, leave. 2 to Thurston.
I noticed
The
Shelley's
norm.
already.
Yeah, Shelley's already. Well, we've already had this talk, this discussion. So, the one, Cody's leaving. He's going to work for Thurston County. Katie Otanias, who's been our water quality person, is going to Yakima and following her boyfriend down there to Yakima, and we just found out she's gotten a position with Yakima County as their stormwater and floodplain manager.
Wow.
So very good for her. So that's a position we'll have to refill. We did refill Cody's position based on interviews we did in July for another position. We had another candidate that was really good, was our second choice. Contacted her, she said, yeah, I'd love to, and so bang, we're on board. So now I have to advertise and fill this position for Katie. It's just difficult to compete with the higher salaries that Thurston has. That's just kind of the nature of life in a small county.
We can always maybe think about blocking Thurston County's employment recruitment website.
I asked Shelley, I said, so let me know when you're through staffing so I can rebuild my own. Thank you. So,
Okay.
yeah. One other thing that came up this weekend, I was out fishing on the Hanford Reach, and about 6:30 in the morning, my phone started going off, and it's about the Fur Lane Health Center. Several citizens got a hold of me directly, and I was unable to get great cell coverage, but I was able to get a hold of Dr. Stein and Alex. Alex did go out and take a look at it on Sunday, and Cody is working on it this week. They had a sewage line, it looks like a sewage line break under the floor, and it pulled down what looks like the insulation and the vapor barrier are laying in the bottom of the crawl space, mold, and there's a contractor who's working on it now to get the things repaired, cleaned up, and we're going to turn this over to DSHS, who really is kind of the backbone agency for nursing homes and DOH. But we'll continue to monitor through our environmental health folks. So, but we're going to make sure the coordination is done, and then we'll be pulling the building inspectors into that as well as time goes on. There'll be plumbing and mechanical, and I'm sure some other inspections will have to go with that as well.
From the city.
From the city.
From the city, yeah. So, and I did talk with Sean this morning, who is their building official. So, so he and I talked quite a bit to make sure that we're on the same sheet of music with things between the city and the county. So.
Okay, so now we're up to the vaping ordinance.
Yeah, so over the summer I had a conversation with Dave, Lydia, and Dr. Stein. We had made some changes to our county parks ordinance, and I noticed one of the areas that we do prohibit tobacco use, but it wasn't clear in our code to explicitly call out vaping as well, which I think would go along with the intent of those restrictions. And so through conversation with staff, I thought it'd be appropriate to start a conversation here at the Board of Health and hopefully get a recommendation from the Board of Health to ask the County Commission to make this change to county code. And so I wanted to put that out there, and I think Dr. Stein had mentioned a couple of other items that are vaping related, and so I would certainly be open to having that conversation as well, but I thought a good place to start would be making those clarifying changes to our county code so that it was clear that that went along with a tobacco prohibition. In particular, as we see in the news now, the issues that are arising from vaping, and so being aware of that, and then trying to use that as an opportunity to have our public health folks do more outreach and have a sort of concerted and focused effort on it as the issue continues to become more and more, center for us. So I wanted to put that out there. I'd be interested in hearing thoughts on that, but certainly would be also looking for a recommendation from this group to make that code change.
So to clarify, our code around tobacco is not as clear as it needs to be by itself. So that has to be adjusted as well. So we'll just roll this into that corrective process to make sure it more closely resembles what's in RCW.
I don't know, Dr. Stein, if you want to maybe jump in and add a little bit more to that, and just to, I hate to say flavor the conversation because that seems kind of yes.
Well, absolutely. So vaping is a huge topic right now. I think that I saw some data that showed that in the past year, the use has increased by about 87%, which is huge. And I think that's, and this is just conjecture completely, but I think that's probably what's contributing to this current outbreak of this vaping-related lung injury. I'm guessing it was around before, but we're just finally now, because of the increase in use, starting to see these cases that are coming out. So this is absolutely a big topic, and it's very much in the news. It's very much on the forethought of a lot of people, especially when it comes to teenagers using these products. And I think what Commissioner Schutte is mentioning is that we want to kind of come out as I would support coming out as a community in order to reduce the visualization and reduce the notion that this is an acceptable thing to do on our public lands. I think the more people who are using in public areas, it basically conveys a message that this is good and acceptable. There are some uses for vaping, and we can get into that later. But in general, especially as these kids are using it more often, we had kind of in the history we had a lot of success with reducing tobacco products for many years now because of reducing childhood tobacco use. And we know that people who don't start smoking by the age of 21 tend not to smoke at all, or start smoking later on in life. And so this current trend is really creating a new population of people who are addicted to nicotine products and will sometimes ultimately start smoking again. So initiatives like this I would strongly support. Other things that I mentioned when I was speaking earlier is trying to reduce the marketing to younger individuals. Another very successful initiative that the country utilized previously was prohibiting flavored tobacco products, and because they do strongly promote younger individuals using. And so if I would, the federal government is currently evaluating the potentially prohibiting these products on a national level. But given our current case and given that we want to come out in strong support for public health, I think this would be a really strong move to prohibit flavored products within our county lines. So that those are, I know that would probably come along with some hesitation because the flavored products piece could impact businesses in our area. But in my role as a health officer, I think that would be a strong statement to make.
I believe education has to go along with that. I see on television some of the advertisements, promoting it, because you can then not be smoking tobacco, but you can be vaping these. So I think the education, I think that our kids aren't thinking that this is just as bad or worse than the tobacco itself.
I think that one of the big issues is that we don't have long-term data for these products. My other position, I'm a clinician, so I'm a family doc, and I speak to tobacco use frequently with my patients. Probably, I tell my patients, probably it's better than smoking, but we just don't have any data.
Right.
And we also don't have regulation. And so there's not really a strong sense of what is put into these products. There's not really a lot of them are made in these little mom and pop places that there's not a specific level of nicotine that they're using or other additives. And so, down the line, we're starting to learn maybe that's not the case. It's hard to say right now because it's such a new phenomenon, and we just don't have any safety data yet for long-term use.
So I personally think that we could maybe pass something here to move on to the commissioners anyway. Would anybody have a...
As far as the flavored products go, I know there's a number of bills being considered this next legislative session, and all of them include preemption.
Yeah.
So I'm not sure what we can do as far as a local ordinance on flavored products when the state has preemption.
But we could at least pass that we...
We can pass a support.
Yeah.
Well, if I recall, the ordinance that governs what you can do in county parks prohibits smoking and drinking. Isn't that right?
Right, and we can prohibit that in county parks.
Yes.
County parks, county property.
Yeah, I think that part is very clear. We've had...
Yeah, so couldn't we just do that?
At least for now.
Yeah.
And I think it would be helpful if we came back in November with a little bit more information on what a flavor ban
would do.
And I'll also know by November, we'll have had legislative steering committees for both Wasafo and Wasac by then. So I'll know more by then.
Yeah. So I mean, personally, I would be supportive of evaluating the flavored vaping and products like that. I think that it wasn't too long ago, probably in some of your lifetimes when we had doctors endorsing like the doctor's choice, Lucky Strike or whatever, and
Ronald Reagan even.
Right, yeah, the Gipper. So I mean, we have we've come a long way on tobacco, to the point where their advertising is severely limited. It's still kind of the Wild West on vaping and vape products, and I think there's a lot of work that ought to be done and will be done at the state and federal level on that. But I think we have an obligation and an opportunity to get out in front of some of these things, in particular since we're now home to one of the few cases in the state here in Mason County.
I was hoping this would be a healthy alternative. I mean, that's what we heard at the legislature, that the vaping was going to be the healthy alternative to cigarette smoking.
I think one of the things we're going to see, though, is in individuals with other comorbidities, it becomes a confounding factor that makes, you don't know which way it's going to go to them.
Right.
And I think the way to address that is that kind of piggybacking on what I was saying earlier is It's probably better than cigarettes, but at the same time, we're also promoting this in people who don't smoke. And so this is a way that teenagers who haven't been exposed to cigarette use are now using these products a lot more readily and are getting the nicotine addictions.
Well, it tastes good and it smells good, so.
Exactly. If it doesn't taste good, a lot of them probably wouldn't use it.
Make them garlic flavored or something.
Yeah. I mean, garlic sounds wonderful.
Right.
So do we need a motion to?
Yeah, I would, if there's somebody willing to make a motion on that, I would think that'd be helpful.
I move that we support the prohibition of vaping in county parks, or county property.
Right, I'll second.
Okay, all those in favor?
Aye.
Aye.
Okay.
Very good. Thank you. Appreciate that.
I know I should know this, but do you have any clue if we have the cigarette prohibited in city parks?
I would imagine. I mean, I think that was a big push
Yes, it is.
several years ago.
I was going to say, I think it is.
So I wonder if we need to go back and do the same
You may.
for the city park.
Wouldn't be a bad idea.
Okay.
I think we should also look at our county policy for our employees to make sure that that's covered in there too.
I will check with Dave or Jeff on this.
Interestingly, last summer I went through Forest Festival, and then the year before I went to Oyster Fest. Of course, when it's pouring, it's tough to smoke. But and did actual counts, and at Forest Festival, I think I only saw 5 or 6 people smoking as I, in my walk through back and forth. So the number of people smoking in public has dropped, a great deal.
Right.
So
There's quite a few vaping.
But vaping is, is another story.
Yeah.
Okay.
And I think the reality is, I mean, whatever action we take on this, probably get some heat for it, because I think there are a lot of people who do use vape products. Some even use it as a, smoking cessation tool.
Right.
But I think there's this element of it that's been promoted as a safe alternative, and I just don't think that's there yet. I don't know that we have.
Right.
We're seeing the issues that we are. So.
And with what's on the news, they shouldn't think it's a safe alternative.
Yeah.
Okay. So 2020 budget.
Okay, so a lot of what I was going to put into the budget work is actually in these packets as a referral to what we've done in the past. So basically, our budgets are essentially flat. I am going to go to the commissioners. I already talked to Commissioner Schutte about this and ask for some reinstatement of funds on the county contributions, which used to be $788,000 per year and now are $378,000 per year. So I'm going to ask, and we'll have a discussion, and we'll go from there. If we get the technical fix, that would be another $42,000 of flexible funding into health. That's the city. And if we get the other portion, that could be as much as another $100,000 that would come into the county to do vaccine-related and Hep C type work. So at least one more full-time position. And that would be in the community health side of the house. Because right now, that's one place where we're really lacking in the things that, when you review death certificates, the things that really kill us, diabetes, obesity, smoking, we have no funding because it's not the shiny new thing. The legislature is not funding those things anymore. And the smoking money, when you think back in 2009, we're getting about $555 million a year. It was the state's 5th largest and most stable source of funding was cigarette tax. And all of that was swept to the general fund, and now public health gets not a dime of that money. So the only thing they do fund it now is about $2 million for the quit line. And that's it. So we need to start, Dr. Stein and I have talked about this, we need to start focusing on those things that we know are killing us, but they're big cultural and society type changes, and like smoking, it's going to take a while to get through them.
I wonder, because of the new reorg at the House level, if because of her background, if she may be more receptive to bringing funds, taking funds back, or sending them back to the park.
She wasn't last year, but we'll see. Because I mean, there are just so many hands in the cookie jar trying to, look at state funds. It's just difficult. You're competing with a lot of other good ideas, but just a lot of other ideas.
Okay, so other business and board discussion,
Well, why not? So I have a couple of just quick items. Tomorrow is our Behavioral Health and Housing Advisory Board. A couple of weeks ago, Commissioner Trask, Commissioner Netherland, and myself toured the county's Housing Authority board properties with the chair of the board there, Kathy Haig. We've through the processes established for the Behavioral Health and Housing Advisory Board, we have been evaluating our programming and different funding opportunities. Since our last meeting, we adopted an ordinance and resolution at the county level to implement legislation under House Bill 1406, which means that we get to retain a portion of the state sales tax here in the county for affordable housing projects, capital projects. And so we've already begun a process to evaluate those dollars and how to use them. And so coupling that with other funds that we have from recording fees, we have funded $190,000 to the Quixote Village Veterans Tiny Home Project, and then $50,000 to the Housing Authority Board for capital improvements. Both of those projects will be inside city limits, which is in keeping with our commitment to the city of Shelton to partner with them on the money that is retained under House Bill 1406. So we're doing some things on the housing side. I met recently with Crossroads Housing to talk about doing a housing trust fund project again in our community. So the facilities that they have as you head up the hill and out of town, those were funded through housing trust fund dollars a number of years ago. I think we're at the point where we need another one of those kinds of projects in the community in order to increase housing availability. So we'll continue working with them and other partners on housing projects in the community so that we can increase just available housing units for people that need them. So more to come on that. We're also working closely with the Thurston Mason VHO on that transition for 2020, and the triage facility on CODA is still under work, but I think we'll be able to start moving in there in early November. Telecare is the contracted provider in there, and they'll be getting in there and up and running late this year on the first floor, which is 16 short-term temporary hold beds, and then they'll continue doing the construction on the second floor, which will be an additional 16 long-term beds. So it's it's good to have that facility here. It's already full in theory. We know we need the bed space. We know we need the legislature to do more in terms of funding capital projects that go to that. In particular, as the governor and legislature continue to shift civil commitments out of Western state and into the communities, we need to have more space. So we'll continue to do that and look for funding to do those projects. So more on that hopefully for our November meeting, and we'll have a better idea of when they'll start accepting clients. The other part of that is the involuntary treatment court that goes along with that, the ITAs. That kind of falls to the county to handle that from the prosecutor and public defender's office. So that's going to be another issue that we're going to have to go to the legislature and ask for some cash. And then we're not the only ones. I think Thurston County's in a similar position where they're going to be trying to get some extra dollars too. So I think that might be a area of focus for the legislature in the 2020 session.
Okay. Public comment.
Thank you. Tom Davis. I work with veterans. I'm a veterans advocate, but I also get involved in all the veterans, particular issues that are particular to veterans. What I want to just make three small points. I'm really pleased to see that we could discuss something like the vaping issue on the last meeting and have action this meeting. That's very encouraging. I really like to see that because that's your statement. That's where the rubber meets the road. All the rest of it is just talk. We put it down into law. I think you can get behind this, and not only, it's kind of a twofold thing, not only do the right thing, but also raise your profile. Dr. Stein, welcome. Your agenda is ambitious. I think it's wonderful. I think that's going to be also a strong step in the right direction. A couple other things. Kathy McDowell's got a little fundraiser going for Hoops. Now, that might not seem like much, but it's a big deal. And it's a big deal because it's an urban type of an issue. The city doesn't have a health department. You're the health department for the city. So, and she's raised, what are you up to now?
We're up to almost 5,000.
Up to almost 5, you were only asking for 3.
No, we were asking for 42, but we need for maintenance ongoing.
So,
So we don't have to burden the city with that.
And that's all private, just people kicking in, but I would like to see a more symbiotic relationship when somebody takes it upon himself, and you're doing this not as a council member, but you're doing this at
Lions Club, Shelton Centennial Lions Club,
right.
yeah.
So when these type of efforts come up, throwing a few bucks around makes a big deal. I don't know what the logistics of that would look like. I don't know if you have to go through some particular protocols that would prohibit that, but it looks good. It just looks good when somebody takes it upon themselves to do something extraordinary, and the municipalities kick in because they're leading. It's a wonderful thing to follow and get some things done. And the last thing I wanted to talk to you about, and I was talking to Abe about, my wife and I were in Eugene, Oregon a while back, and we were in a shopping center, and suddenly there was, I guess you call it a flash meeting, is that,
yeah.
All of a sudden, all these people came from nowhere, and they came to the center of the shopping center, and they all started to dance from New York, which of course, I was all in, and they did that, and people came just all out of the stores. Must have been 400 or 500 people, and everybody's were participating, and it was put on by the health department, and it was just terrific. And then it was over, and everybody just dissipated back into the stores and everything. This kind of high profile, raise the roof type stuff is really good for public health. We're a county that needs this high profile. We shouldn't, it's great to have programs, but unless people really know about the programs, I could see a program across the street where people are doing calisthenics at lunchtime. I think we'd get more participation if you had a 5K run that was put on by the health department. Just kind of get all in on this because we're not a healthy county. And the only way we're going to be a healthy county is to bring it into the sunshine and have the health department back at 100% in a whole high-profile manner. Advertising pays. Thank you.
That's good. Any other public comment? Thank you, Tom. I guess, do I hear a motion to adjourn?
So moved.
Second. Okay.
Tell Shelley thanks.
Oh, absolutely.